Good morning. We are at Joy Family Dental with Dr. Montroy, and she has her office manager, Todd Branson, here. For those of you who got an opportunity to watch the previous video that was filmed in December of last year, Dr. Montroy took over the practice from her dad, Dr. Branson, in January of this year. And Dr. Montroy, since we last visited, can you tell us how things are going for you with the change?
Yes, so first I wanted to introduce Todd. He's my office manager, also my brother. But he actually does a lot behind the scenes. He takes care of our business, he designs our website, and he manages the whole entire office for me. So I'm going to have him give you the update on the business side.
Thanks, Dr. Montroy. So in answer to your question, Andrea, the practice is doing really well. We've actually been in operation since 2009 when my dad and mom first started the practice. It was Branson Dental originally. And we've since transitioned to Dr. Montroy being the full owner of the Watauga location, Joy Family Dental. Joy being not only what we want to bring to our patients, but it also has family inspiration because Joy is the middle name of my sister, my mom, and our newest addition, Dr. Montroy's daughter. So the practice is doing great. We have many new patients every day that are coming in, alongside our long-standing patients that we see regularly. Our primary focus is to provide everybody that joyful dental experience that you don't necessarily get at every practice. We want to bring you in and treat you like family. Give you that warm and fuzzy feeling while also giving you the education about how to properly take care of your oral health. As far as new patients go, we're always accepting new patients. We do accept most major insurances. And if you don't have insurance, we also provide a great discount plan. We also have our memberships, $25 a month, gives you exams, x-rays, and cleanings at no additional cost 2 times a year. Plus, it gives you 25% discount off of all dental services. So if you have any friends or family that are in the market looking for a dentist, please come and talk to us. We'd love to have you part of our family.
Great. So, Todd, I actually got to know you because I'm a patient of Joy Family Dental. So your dad used to be the dentist that I saw, and now I get to see your sister, Dr. Montroy. And I do try very hard to keep up with those regular visits. I know they're important twice a year, as you said. And I've also had some other specialized services that Dr. Montroy did. And I do agree that it is joyful to come in here. Little play on words, but she was very patient and kind, and the other staff members, constantly checking on me, making sure that I was doing good. So I can say that it's a very pleasant staff. What are your hours here, Todd?
Right now we're doing Tuesday through Thursday. We start seeing patients at 9:30 and we see our last patients at 4.
Okay, perfect. And can they book their appointments online, or is
Absolutely.
there a phone number you'd prefer them to call? What's your preference for somebody to book an appointment?
Our preference is whatever the patient's preference is for booking an appointment. So we have many avenues. We have phone calls that you can do. We also receive text messages through our phone number. And then we've got appointment requests online that people can make as well. And with the appointment requests online, they can either say that they would like to have a phone call, text message, or email back to discuss scheduling appointments. So we are very versatile on how we are able to book appointments.
And then, Todd, I know some dentist offices, when we visit them, I've seen the sign like Care Credit. Is that another avenue that Joy Family Dental offers?
So one of the things that we do offer is Care Credit. It works just like a credit card. You do have to go through an approval process, but you can do up to 6 months no interest on the treatment that you need to have done. And it's a great avenue financially for people to take on so that they can move on with getting back to a good oral health.
Dr. Montroy, I have always heard that you can tell as a dentist if there might be some type of underlying medical condition with a particular patient. Can you talk to me a little bit about that and how true is that? I've heard, like certain things you can kind of detect, early detection as a dentist.
Yes, definitely. So when you come in to see us, we do a full mouth examination. And so we're going to check and chart out your teeth, check for decay, broken fillings, broken teeth. We do gum measurements. So the gum measurements help us detect gum disease and periodontal disease. We also do an oral cancer screening, and that is something that we do. We check the soft tissue to make sure we don't see any color changes, lumps, bumps, anything out of the ordinary. A lot of people aren't aware, but oral cancer is on the rise. And so we take that very seriously, and we do that oral cancer screening once a year. It's included with your exam. But yeah, your oral cavity really tells a lot about the health of the patient. And one thing people should keep in mind is it's connected to your respiratory system, your circulatory system, your digestive system. So you want to keep your mouth clean, because anything that could be going wrong in your mouth, the bacteria, if you don't keep it clean, can affect all those systems that are connected to all your major organs. So it is really, really important to maintain good oral hygiene, and also come in every 6 months. And for some of our patients, they're more cavity prone or they have gum disease, we may recommend more frequent visits to combat that.
Also, I know that when you come in, or at least here, y'all ask about medical conditions that the patient might have. So I think that you would expect a patient to be totally forthcoming with that information, because that will help you provide the best care for them.
Absolutely.
Okay, perfect.
Yeah, it will help us customize the care. It'll help us, to recommend more daily treatments. People that have diabetes or they're going through cancer treatment, they need more than just their home care. They need prescription home care, mouth rinses and toothpaste, and those really make a big difference for people that have certain health conditions or problems with what we call recurrent decay.
Okay. And you were talking about oral cancer. I know I've always thought that that's only going to happen with people that either chew tobacco or smoke cigarettes. Is that something that you see in patients that don't partake of tobacco products?
Yeah, so it's kind of a taboo subject. People don't like to talk about it a lot. And while tobacco and drinking alcohol together is the highest risk, we're seeing a rise in the HPV. So HPV is a virus that you could catch, and there's certain types of that virus that do cause oral cancer. So we're seeing a rise in the diagnosis with that for people that either don't smoke or drink. They may still be coming up with just from the virus.
Right, it's kind of like lung cancer then, because I know there are lots of people that get lung cancer that have never smoked or done dipped tobacco in their life, that they end up with lung cancer.
Right.
So, very good. That's good to know, because a lot of people do think like I did. I know that y'all also offer some cosmetic services. Can you tell us a little bit about your cosmetic services?
I really enjoy cosmetic work. I love doing cosmetic crowns to straighten or change a person's smile. And then we offer professional whitening. So we do the Zoom professional whitening and take home professional whitening. We can make you custom trays to wear at home. But those are just a couple of the cosmetic services that we offer.
Can you tell us a little bit or give us some examples of some type of other physical health ailments that you might be able to detect as a dentist, and why it's so important for those individuals to be forthcoming with you during their dentistry visit?
Of course. So one of the screenings we do is a blood pressure screening, and the reason that the dental board recommends we do that is a lot of people will not see their primary care physician. They won't go see the regular doctor, they'll go see their dentist for a problem. So we do the blood pressure screening to catch hypertension, and high blood pressure can lead to a lot of problems: stroke, heart disease, things like that. So that's one reason we do take the blood pressure, so we can catch hypertension and refer them to their primary care doctor. And of course, the periodontal disease, the gum disease, and some gum abscesses or tooth abscesses can be linked to major health problems, such as the cardiovascular disease. A lot of people don't realize it can cause adverse pregnancy problems, like low birth weight or premature delivery. It's been linked to Alzheimer's. That's a new thing. Just in the past year, they found that some of the bacteria can put off a toxin that can contribute to Alzheimer's. And there's many other like diabetes, and they're even finding some GI issues like Crohn's disease are linked to it. So pretty much your mouth and the health of your mouth can really determine, your well-being and how you feel, day to day. So it's important, like I said earlier, to get your regular checkups and let us do those screenings so we can catch and treat those things before it makes the rest of your body sick.
The dental care, your oral health is very important, not just for your mouth, but also for the rest of your body. So
That's right.
this has been very enlightening today, and I wanted to make sure that both you and Todd know how much the city of Watauga appreciates y'all providing not just general dentistry, but the fact that you have a family business, and that means a lot. I know a lot of residents, that's very important to them, and I think it's really special that you came up with the name Joy Family Dental as a result of you and your daughter and your mom sharing that same middle name. That is really neat. I think a lot of people probably can relate to that as well. So thank y'all very much for being a vital part of this community. And are there any final comments or statements that you would like to make?
Well, I'd just like to say for the past 10 years, I've really enjoyed taking care of the community of Watauga and its citizens, and we're just here to serve and help in any way we can.
Great. Todd, any final thoughts from you, sir?
We love to look forward to seeing you for all of your dental needs. This isn't your typical dental experience. We're not here to sell you. We're here to provide you with proper dental care that you need.
All right. So if you are looking for a general dentist with certainly a flair for a family environment, please do contact Joy Family Dental, and you can reach them through the business directory that we have launched online at the city's website. Thank you all for watching.